Hi there. Thanks so much for tuning in today. My name is Catherine Largent. I'm a physician assistant student at A.T. Still University. I'm currently enrolled in the Social Determinants of Health class, and today we're going to be talking about walking into wellness, building a provider-led community-based walking program to help address some of these social determinants of health. I think in order to develop a successful community health promotion initiative, it's important to discuss what constitutes and contributes to an individual's overall health and assess overall community needs and health. Oftentimes we think of genetics and individuals' characteristics and behaviors as being the main contributors to health and wellness. However, the community in which one resides is really important in contributing to overall health. Environmental factors such as physical safety, social environment, and economic environment, employment status and income, education level, social connectedness, food and housing security, access to healthcare, and policy and infrastructure all play a role in overall health and wellness. What is social determinants of health? These are inherent characteristics within a community that affects an individual's general health and well-being. This includes their health outcomes, functional ability, and quality of life. What constitutes a community? That is the neighborhood in which an individual is born, lives in, studies in, works in, plays in, and grows old in. Social determinants of health account for 30 to 55% of all health outcomes. Addressing social determinants of health improves community health and longevity. This brings attention to health inequities in communities. Health promotion initiatives that target social determinants of health decrease all-cause morbidity and mortality. So aiming to address these on a national, state, and local level will help improve the community's health and help reduce incidence of chronic disease. So for my health initiative, we're talking about the importance of physical activity. Research has shown that meeting goal physical activity levels weekly prevents chronic disease, disability, injury, and premature death. It promotes physical independence as one ages. Direct health benefits associated with achieving adequate amounts of physical activity includes improvements in physical and mental health. Promotion of meeting goal physical activity metrics on a community level can help combat social determinants of health. There are U.S. physical activity guidelines based on age. For adults, it is recommended that they get 150 minutes a week of moderate intensity aerobic activity, as well as 2 days of muscle strengthening activity. Children are expected to get 60 minutes a day of moderate intensity aerobic activity and 3 days a week of muscle strengthening activities. Benefits of physical activity on physical health include improvements in cardiovascular health, decreased risk of cerebrovascular disease and diabetes. It helps regulate blood pressure and cholesterol levels. It helps burn fat to promote a healthy weight. It strengthens bones and muscles, and it helps prevent falls. Mental health improvements include improved mood, energy, self-esteem, socialization, sleep quality and length, as well as overall quality of life. Decreases risk of depression, dementia, and Alzheimer's disease. It helps reduce stress and anxiety levels and helps combat fatigue. Physical inactivity is associated with higher rates of obesity, cardiovascular disease, cerebrovascular disease, diabetes, neurocognitive disorders, some cancers, and it increases overall morbidity and mortality. In order to talk about a health promotion initiative, I think it's important to bring up the common illnesses and ailments that affect the community members in the target community. So the leading cause of death in this community is cardiovascular disease, malignant neoplasms, chronic lower respiratory diseases, cerebrovascular diseases, Alzheimer's disease, diabetes, suicide, and chronic liver disease. This is excluding for COVID-19 infections as well as accidents. The target community is Murfreesboro, Tennessee, which is in the epicenter of Rutherford County. This is a fast-growing suburban community that is southeast of Nashville, Tennessee. This community is diverse with regard to race, ethnic origin, age, and socioeconomic status. Many of the community members have graduated high school, have a bachelor's degree. This is the town in which the state college is in, so there are 20,000 students enrolled there. Many of the residents in the community work, and approximately 11.6% of residents live in poverty. Many residents have pretty good access to health care, with only 9% lacking insurance, and about 67% have seen a primary care provider in the last year. The target community, adult residents, are considered physically inactive in about 26% of community residents. Community health overall, about 14% of patients describe having chronic mental distress and 11% describe chronic physical distress. About 8.1% of community individuals suffer from disability, and 20% of community members are smokers. What is not unsurprising is many residents suffer from chronic medical conditions such as obesity, hypertension, hyperlipidemia, and diabetes, all of which contribute to overall health and wellness. The health promotion initiative we're going to be addressing today is called Walk with a Doc. It is a primary prevention intervention. It's going to improve Murfreesboro residents' health through movement and conversation with community healthcare providers. It's going to be led by physician or healthcare providers with an advanced degree. It's going to promote physical activity, health literacy, social connectedness, health education, and spending time in nature. We are going to meet every second Saturday of the month from 9 a.m. to 10 a.m. We'll meet at the Murfreesboro Greenway system. Anyone is welcome to join the event. Community members are welcome regardless of age, race, socioeconomic status, education level, and ability level. The first 10 minutes of the event will be a discussion on current noteworthy health topics, chronic health conditions, and health promotion screenings. The next 40 minutes will be a walk along the Greenway where one can walk at their own pace. The leading provider will walk arm in arm with the participants and will help encourage discussion on health-related issues between the provider and the participants. At the end of the event, the last 10 minutes, we will provide healthy snacks and health screenings such as blood pressure checks. The event atmosphere aims to create an informal, relaxed setting to engage community members and ease their anxieties associated with talking to healthcare providers. We are going to recruit participation by offering volunteer hour credits to physician assistant students who participate from the community program. We are going to partner with local healthcare providers for walks. We plan to market at local schools, advertise at medical offices, local vendors, and radio and television outlets, as well as using social media. We plan to target social determinant of health areas of healthcare access and quality, neighborhood and built environment, and social and community context. Healthcare quality and access, Walk with a Doc will benefit by fostering relationships between community members and local healthcare providers. It will help engage students in the local PA program. Education will be provided on chronic health conditions. We will discuss current health concerns affecting the community. It will incorporate health screenings. It will provide participants with local resources to address healthcare needs and aims to improve community residents' health literacy, mood, energy levels, and patient and provider relationships. Improving health literacy is an important community initiative because it reduces inappropriate emergency department visits, hospitalizations, it improves overall health outcomes, it increases utilization of preventative health visits, improves patient-provider communication, and improves participation in health screenings. Failure to do so leads to delays in disease detection. Early diagnosis is needed and initiation of treatment to prevent organ damage and disease progression. Providing community-based opportunities for physical activities improves residents' overall health and quality of life. It also is associated with increased community safety. Examples include using greenway systems, recreational facilities, public tracks, sidewalk access, and bike lanes. The Walk with a Doc initiative will be promoting physical activity outside on the greenway system. Compared to the national average of 23%, 40% of those who participate in Walk with a Doc meet U.S. guidelines goal physical activity levels. And the last social determinant of health that Walk with a Doc intends to address is social and community context. Social networks can have positive and negative effects on health. Social networks include relationships between family members, friends, colleagues and coworkers, neighbors, and community members. Walk with a Doc benefits include encouraging social interaction, formation of support networks, social cohesiveness, participation increases, health behaviors, and things such as physical activity, engaging in screenings. Failure to promote social cohesiveness can lead to unsafe communities, such as increased rates of violence, incarcerations, and discriminations. These effects can impact community members' health and safety negatively throughout their entire lives. This health promotion initiative will have evaluation and assessment planned in. The main goal of this initiative, it's starting, is that by participating with Walk with a Doc, 40% of attendees will meet goal physical activity levels as recommended by the U.S. Physical Activity Guidelines. Formative evaluations will include process evaluation, impact evaluation, where we will record minutes of physical activity completed weekly, weight maintenance or loss, smoking and alcohol consumption habits, as well as changes in medical comorbidities. Outcome evaluation will include feeling of social connectedness, as well as utilization of community-based resources for physical activity. This will be done through questionnaires that participants will complete at their first walk and quarterly thereafter. In conclusion, using social determinants of health to address health inequities within communities improves community residents' overall health, functioning, and quality of life. Walk with a Doc in Murfreesboro, Tennessee is going to promote physical activity to help prevent chronic disease, disability, injury, premature death, and will help address the social determinant of health domains, healthcare access, quality, neighborhood and built environment, and social and community context. Here are my references. Thank you so much for listening to my initiative.